Alright, I'm going to attempt to do the brachial plexus the best that I can. Brachial plexus derived from C5, C6, C7, C8, and T1 nerve roots, or the ventral rami of those spinal nerves. Remember, it is the ventral rami that form the plexuses. C5 and C6 come together to form the superior trunk. C7 continues on as the middle trunk, and C8 and T1 join to form the inferior or lower trunk. Now let's stop for a second and talk about the branches here. Off of C5 nerve roots comes the dorsal scapular nerve. The dorsal scapular nerve. Off of the superior trunk, or derived from the superior trunk, comes the suprascapular nerve, derived from C5, C6, innervates the supraspinatus and infraspinatus muscles. Back to dorsal scapular, innervates levator scapulae and rhomboids. We've also got the nerve to subclavius muscle, and then off C5, C6, and C7 come the long thoracic nerve for the serratus anterior muscle. All three of these trunks, remember roots form trunks, all three trunks divide into anterior and posterior divisions. The posterior divisions of all three trunks form the posterior cord. Derived from the posterior cord is the upper subscapular nerve, the thoracodorsal nerve, and the lower subscapular nerve. Upper subscapular nerve is derived from C5 and C6, thoracodorsal nerve from C6, 7, and 8, the lower subscapular nerve also from C5 and 6, and then we have the continuation on of the posterior cord, which is the radial nerve, and then the axillary nerve. Remember, it's called the posterior cord because it is posterior to the axillary artery. The lateral cord is formed by the anterior divisions of both the upper and middle trunks. Here's the lateral cord. It's lateral to the axillary artery. It gives off the lateral pectoral nerve, C5, 6, and 7 for pectoral muscles. Then we have the musculocutaneous nerve. This is pectoralis major muscle. You have the musculocutaneous nerve, and then the lateral contribution to the median nerve. The medial cord is a continuation of the anterior division of the lower trunk. It gives off the medial pectoral nerve for pec major and minor. It gives off the brachial cutaneous nerve and the antebrachial cutaneous nerve. Continues on as the ulnar nerve, and then the medial contribution to the median nerve. You can see the M here. The M stands for musculocutaneous, median, and ulnar. The brachial plexus.